Okay, so at this time, what I'm going to go ahead and do is I'm going to introduce Michelle Lopez. She is a registered nurse. She's a senior vice president and system chief nurse executive, along with Dr. Tom Greeley. He's the vice president of clinical affairs, and they've got some slides they'd like to share with us. And so go ahead and please take it away.
Thank you so much, Mayor McGallian. Dr. Greeley and I are really honored to be asked to come and be part of this town hall. We want everyone in our community to know that John Muir Health nurses, physicians, clinical and support staff are here ready and able to care for our community. We know that there are a lot of concerns and questions that many of you in our community have, and we share with you that this is a truly unprecedented time in healthcare and in the world, and we have been preparing for something like this for quite some time, and we wanted to just take an opportunity to share with all of you what we are doing to keep our employees safe, our patients safe, and our community safe. Before we start, I also want to thank the community because we have early signs that the social distancing that everyone has taken to heart is working. And so we want to reemphasize how important that is. And so we're going to talk a little bit. Dr. Greeley is going to get us kicked off talking about the coronavirus, COVID-19. I will speak about what we are doing and what we have been doing to prepare for this, and then we are more than willing to answer any and all questions that anyone on the call has. So I'm going to go ahead and turn it over to Dr. Tom Greeley. He is our Vice President of Clinical Affairs. Thank you so much.
You can see us practicing our social distancing there. I'll add my voice of thanks to Michelle's, both professionally and personally. Michelle and I both are residents of the city of Concord, so we're thrilled to be able to participate and talk about what we've been doing. Next slide, please. Thank you. So this is a high-powered picture from an electronic microscope of our foe, of COVID-19. COVID-19 is a coronavirus. Corona is the Latin word for crown. And if you look at this picture, you can imagine the crown around there you go, perfect, around the outside of the virus. And that's how it got its name. Next slide, please. So what is COVID-19? Well, first, let me talk about where COVID-19, the word came from. The C&O comes from coronavirus, which is the type of virus that we're dealing with. VI is virus. ID is infectious disease. And 19 because it occurred in 2019. So that's how the name COVID-19 came up. It's coronavirus infectious disease of 2019. As I've already said, it's caused by coronavirus, and these aren't new. There are 7 coronaviruses that are known to cause disease in humans. And they're all a particular type of virus, an RNA virus. That refers to the genetic material in the virus. So although COVID-19 is a new member to the family isn't new to us. With COVID-19, the most common symptoms are fever, cough, and shortness of breath. And important to note that 80% of the cases are mild to moderate in severity. It's spread by respiratory droplets and on contact with infected surfaces. And this is an important point to remember. So on average, an infected person can spread the infection to 2 to 3 other people when they're not taking any measures to prevent that. So if they're not wearing a mask or they're not doing social distancing. And then there may be some spread, fecal oral spread, because it is found in stool. Next slide, please. So the incubation period. Incubation period refers to the time between someone contracting the virus and actually showing symptoms. And that can range from 1 to 14 days with an average incubation period of 5 days. In terms of infectiousness, or how likely someone is to pass it along, people have the ability to pass the virus on from approximately 12 hours before they ever have symptoms to 5 to 7 days after they develop symptoms. And that's an important reason why the CDC has now come out with the recommendation. And you'll notice that both Michelle and I are wearing masks, as are everybody, all our employees, all our physicians in the hospital. It's not, in this circumstance, to keep us from getting corona. It's in the off chance that we may have it and be showing no symptoms. So it's to prevent us from passing it along. When we're providing direct patient care, there's different PPE or personal protective equipment that we'll use to prevent us from contracting it from the patients. But for folks in the community who are now being asked to wear a mask, that's why you're being asked to do that. The estimates range from 20 to 60%, depending on where you look, in terms of the number of people who may actually have coronavirus, not have any symptoms, and be able to spread it. Next slide, please. So this is a graphic representation of why social distancing is so important. If you look at the tall purple curve, that's a pandemic where the community has taken no intervention. And you can see there's a very rapid and steep peak to the number of infectious cases that occur. Versus curve number 3, the lower, which is a more gradual, slow, and not nearly as high a peak. And that's a pandemic outbreak when there has been an intervention by the community, when they've taken steps to social distance and prevent the spread. Next slide. I apologize, this is a really busy slide, but I'll point you to the important parts of it. It is an actual demonstration of just what we showed in the last slide. And this is what happened with the 1918 Spanish flu. You can see the big peak, big yellow peak, that was Philadelphia. And it took Philadelphia 16 days from their first case to when they actually socially distanced. So you can see how high it is, versus the experience in St. Louis, which is the lower curve, the blue line, the gray. They took 2 days from the first case to socially distance. So that's why it's so very important to do this. There's actually science behind it. And fortunately, our public health professionals and our government officials in the Bay Area in particular were very quick to respond. And it's probably in a large part why we're seeing the type of curve that we're seeing, which is much more like St. Louis than it is Philadelphia, much more like, or very different from what they're experiencing in New York, fortunately. Next slide. So what can you do? Social distancing. Is it essential? I think we've said it before, but we'll say it again. Absolutely. It's the most important thing that we can do to slow the spread of coronavirus. When you cough or sneeze into your arm or tissue, and make sure you wash your hands or use alcohol-based gel frequently. Try to avoid touching your face. When you're wearing a mask, it's a good idea to Purell or wash your hands before you touch your mask, either put it on or take it off. And please, if you're sick, don't go to work. You may not be certain, but don't go to work if you're sick. For those essential employees who are still going to work, that's the advice that we give to our employees and I give to everyone in the community. If you think you're sick, don't go to work. Next slide, please. I think we answered that question. Next slide. So some medical countermeasures. Testing is important. We don't have the amount of tests that we'd like to have in the US in general, and certainly in California and locally. We do have some tests available. We expect increased availability soon, but we don't have the number of tests that we need. It's important to note that this test is very, very sensitive. As you want for any screening test, when you use a test to screen a group of people or community for disease, you want it to be very, very careful in catching everybody who has the disease. And this test is that test, very sensitive one that's available. For potential treatments, City Mayor or Manager was absolutely correct. No known proven treatments for coronavirus exist currently. There is an antiviral medication that was actually developed for Ebola that has shown some effectiveness and is being used in some clinical trials and in certain cases. Then there's hydrochloroquine and chloroquine with azithromycin. Hydrochloroquine and chloroquine are actually malarial medications, and this combination has gotten lots of press from the president, and it's being used in very controlled circumstances. At this point, we have no idea what the correct dose. We have no idea when in the disease to use it. We don't know what the potential side effects are. So there's lots of information we don't know. It's being studied, and again, in very rare circumstances, usually for folks who are very severely ill and we have no other choices, they are being used. There is no evidence that they work for prevention. No evidence. So there's no reason for people to try to get a prescription or to begin taking them because, again, no evidence that it's effective there. And vaccines are still several months off. Lots of work is going on, of course, with vaccines, but several months off. Next slide, please. And the reason why a vaccine is important is coronaviruses, like the flu virus, tend to be seasonal. So it will not be uncommon if we expect to see coronavirus same time next year. For a host of reasons that I won't go into, particular viruses tend to like particular seasons. And this is the season for coronaviruses. Remember, this is the 7th in the family, and the other coronaviruses we see every spring. So a vaccine will be very important to make sure that we can control it. Should it show up again next year? There's no predicting. It may show up next year. It may not show up next year. We just don't know. Next slide. Michelle now is going to go over some of the efforts that we've taken here at the medical center, both medical centers, all of John Muir Health, to prepare for coronavirus.
Thank you, Dr. Greeley. All right, so early this year, we had been carefully watching what was occurring in China and Italy, and we knew that it was a very real possibility that it would spread to the United States. When the first patients arrived in California from the Diamond Princess, which was just over a month ago, it feels like about a year, but it was just about a month ago, we doubled down on our planning efforts. And when the first community-acquired patient was identified, we knew without a doubt that we needed an all-hands-on-deck approach to planning, and that's exactly what we did. We have a hospital incident command process that we have in place for any disaster that may come our way. And we opened up our incident command center on March 4th, and it's been open 24/7 ever since. And we have over 30 work groups of leaders and clinicians and staff that have been planning for what we have anticipated as an increased number of patients. We're working on our capacity, making sure that we have the right number of beds, critical care beds, medical surgical beds, space in our emergency departments, making sure that we have enough staff to staff this increased patient population, as well as logistics, what all of the things that we need to take care of this surge of patients. We have been planning also for quite some time around personal protective equipment. And you may have heard on the news, stories from New York City, for example, of concerns about not having enough personal protective equipment. We believe that we have the personal protective equipment that we need to care for these patients and to keep our employees safe. And we continue to get more. There's no stone left unturned. And we feel very, very prepared for this. We are incredibly proud of the commitment that our employees and physicians have made to this. I cannot begin to tell you how our teams are fearlessly leading in the face of the fear that I think we all feel. We are constantly taking proactive steps to make sure that all of you can count on us during this critical time. And we are planning for what we're phrasing as a possible worst case scenario. But as I said earlier, and Tom reiterated, we are starting to see changes in the curve, and we are cautiously optimistic. That being said, we are not taking our foot off the gas. We are continuing our planning for what could be the worst case scenario to make sure that we have everything we need to care for our community. Next slide. So what have we done changes-wise to make sure that we're able to keep our community safe? Very early on, we consolidated our urgent care centers, and 4 of our largest locations we consolidated to make sure that we had enough clinicians and staff to care for patients with specific focus on respiratory patients. We've increased our outpatient testing by adding mobile testing sites to our Brentwood and Walnut Creek urgent care centers. And this has allowed us to get more patients through testing, but also do it in a way that we are keeping our community, the patients, as well as our staff safe. We're using telehealth and phone visits. We are doing about 1,400 to 1,500 telehealth and phone visits every day. So for patients that works for, it has been incredible. It's been incredible. It's something that we have been working on for quite some time, and our physician network was able to stand up this technology very, very quickly, and our patients are really, really benefiting from that. We've postponed elective surgeries and procedures, and we did that at the guidance as the CDC and our other agencies were recommending that we do that. This was quite possibly one of the more tougher decisions that we've made, because we know that it impacts patients who have been planning for these elective surgeries and procedures. But by doing this, it allowed us to make sure that we had the workforce focused on the potential COVID-19 patients headed our way. It allowed us to preserve our supplies, our personal protective equipment, and making sure that we had the space for patients that might be coming our way. Next slide, please. So, whoops, one back. We also put a visitor restriction in place, and again, this was a very difficult decision for us, because we know that hospitalized patients, it is very important that they have their families with them. We have our ITS department and our clinical teams are working right now on how can we leverage technology, whether that be through iPads, through Facebook portal pads, etc., for our patients to be able to talk with their families virtually instead of in person. And so we are doing everything we can to mitigate the impact of having those visitor restrictions. But we believed very early on that, again, protecting our workforce was vital, because if we have our workforce going out sick, we won't have what we need to take care of patients that may be coming our way. We are masking, as Dr. Greeley commented, we're masking all personnel, visitors, and patients in all clinical buildings. Dr. Greeley and I are at the Concord Medical Center now, which is why we are masking. We're planning for taking temperatures on all physicians, staff, and visitors that are entering our patient care buildings. We have a work group that has been working on that, and we plan to roll that out early this next week. And we are continuing to focus relentlessly on hand washing and social distancing across all of our John Muir Health sites and services. Next slide. And this is one of my favorite slides. We actually, at both of our medical centers, we showed up one day and found these signs that our community placed there for our healthcare workers. And I cannot begin to tell the community how these signs of support and care from our community, what it does to bolster the spirits of our teams who are inside those buildings working as we speak. We want to thank the community of Concord. We want to thank each and every one of you who are heeding all of the recommendations out there to stay home, to stay socially distanced, because it is making a difference, and it's keeping our community safe, it's keeping our patients safe within our buildings, and it's keeping our healthcare workers safe, which is just so vital at this time. We feel supported by organizations like the Concord Chamber of Commerce and our local government, and we want each and every one of you to know that we are here and we will be here no matter what comes our way. Thank you so much, Mayor McGallian. Dr. Greeley and I are open to answering any questions that anyone on the call may have.
Sure. Thank you so much. We really appreciate your presentation today, and I think you brought up a lot of really good questions. And so what I'm going to do is let's go ahead, and there were a few questions that came in. I know that Valerie was trying to answer a few, and was there one or two? Oh, you know what, do you mind there was one about the masks, in terms of people just kind of understanding the best practice for masks, whether it be cloth masks, medical masks, when to use them, when not to use them, kind of the appropriate nature of what that means. I mean, it's one of those, should they be wearing them when they're at home? Should it be only when you're in the store? Like just kind of that best practice around masks so that can be understood.
Got it. I'll just talk from back here. Okay. So the guidance from the CDC was to wear them when people were out in public, not necessarily at home. You know, for those that we live with, unless we're going to stay 6 feet apart, not touch anything in common, exposure, the ability to avoid exposure is almost impossible. Certainly out and about in public, the recommendation is to wear masks. Not medical grade mask. You could wear a bandana. You could wear a cloth mask. They specifically asked that people not try to wear the N95 mask, which is the medical grade mask that we need for our employees who are providing care to patients with COVID-19. So any barrier, again, cloth, if you tend to have simple masks like Michelle and I have on, these would be fine, but wear those when you're out in public.
And as far as cloth masks for caregivers, there's been a lot out in the media about this, and we have had an outpouring of support from our community wanting to do things for healthcare workers, making masks, etc. We have gladly accepted any and all donations, but at this point, we absolutely have the amount of hospital-grade PPE for our employees, and so we are having our own employees wear the masks like Dr. Greeley and I have on now. But for the public, the cloth masks are just fine. Again, it's to keep yourself from exposing others when you're out.
So another question came in because, of course, we're talking with John Muir, but in terms of that relationship with Kaiser as well, do you kind of know what's going on in terms of whether someone who maybe is a Kaiser patient, can they go to Kaiser or can they go to John Muir if they're concerned about testing? What's the best practice on that among kind of the medical community dealing with COVID, no matter the hospital?
Yeah. I would say, as is the case always in medicine, if you can keep your care with your providers who know you, that is ideal. However, any health system in the county, anywhere, will provide care to anybody in need. So testing throughout the state, throughout the county, throughout the nation is limited. But my advice would be, if people have the option or able to follow up with the system or the provider that they normally seek care with, they know you best, they know your medications, they know your history. That's ideal. But if someone in need, you can go anywhere.
And the follow-up to that, though, and just to make sure we clarify, is, where should testing start? What does that look like? I mean, is it literally just, hey, is it drive up, or should it really start with your primary care? Just so that people kind of understand what that first point of contact should look like.
Yeah, so, the message that we're getting out to our patients is that if you are mildly ill and you have the symptoms that are fever, cough, etc., the symptoms that we're seeing with COVID-19, you should call your primary care physician. At John Muir Health, we have the ability for our patients to call, and then they will be directed where to go, whether that will be to one of our urgent care centers. If people feel sick and truly sick, like they need emergency care, they can show up at one of our, obviously, emergency rooms, and that's the same for Kaiser, John Muir, wherever you get care, you're more than welcome to show up. But again, it's important that if someone is feeling very sick, they can go to any emergency room and they will get care. It's also important to know that just because you want to get tested does not necessarily mean that you will get tested. Our physicians will be assessing each patient, and if there is a high likelihood that this could be COVID-19, you will be tested. But a lot of people think that they can just show up at an emergency room and just ask for a test, and we simply just do not have the supply for that. We are hoping that we will get there. And I know that everyone in the United States is certainly waiting for that.
Got it. Okay, thanks so much. And I'll take another question or two, and if I may have missed one, Valerie, I know you were responding. Was there one or two that you saw that?
Well, there's a few that are appropriate for the medical professionals. One is if you smoke or vape, does reducing or stopping reduce complications with COVID-19? So that's one. And then somebody asked about Sweden's approach to the coronavirus, but I don't know if we know anything about that. And the third is, how do you clean a mask?
I can take smoking or vaping. Sir, absolutely. Stopping smoking or vaping will certainly help in case someone gets sick from anything, whether it's coronavirus or routine pneumonia. Absolutely, that will help. Yeah, for the Swedish experience, I don't have any knowledge about what happened in Sweden. And how to clean a mask, it depends on what type of mask you're describing. For paper masks, we recommend that if it's dirty, soiled, wet, torn, that you dispose of it. If it's a cloth, I don't have any recommendations other than washing, as you would, routine clothes. Hot water and detergent should kill the virus.
Okay. And then I think Melissa was checking, there might be a question on Facebook or two. Oh, there was a question about gloves, and that's kind of a good one. I think how to use gloves, again, the appropriateness of when to wear them, where to wear them. Can you kind of go over some best practices with that?
It's a tough one.
It is a tough one, because best practice for gloves depends on where you're wearing gloves, right? Are you a medical professional wearing them, or you're out in the community?
Let's say for the common person that, hey, you know what, I'm going to go to the grocery store, and is it something where I'm going to put a mask on, but should I put gloves on? When I'm in the, how should I be using those gloves? And also, and I'm going to use the example of, okay, so I went ahead and used the gloves when I put them on when I leave the house, and I touched my steering wheel, and then I touched all the things in the stores, and I came back and I touched my steering wheel, and then I brought them home, but I didn't take them off in a timely manner. Can you kind of step through that process of when they should be used and not used, and what you should be thinking about if you're going to use gloves?
Which is why it's not a recommendation to use gloves, because of those very issues that you raised. But if someone chooses to use gloves, you should wash your hands or Purell your hands prior to putting on the gloves, and then when you take them off. And that's really the best guidance. All the things that you identified are very real. When do you take them off? And what you do to the areas that you touch with your gloves on. With gloves on, you can still transmit virus, just like you can with your hands. So you want to clean your hands, and doff the gloves, take the gloves off as soon as you're done using them. It's a tough question.
Got it. Thank you. And I just wanted to bring that point up. I know a number of people some people may know what to do with gloves. Others, it tends to be kind of a question mark. I think you're right in terms of not using gloves, but washing your hands and making sure you're disinfecting surfaces is going to be your best bet in that regard, usually.
Most effective, yes.
Awesome. Thanks so much. Okay. Any other questions? I also don't mind if one or two people do want to unmute their phone. I'm more than happy to take a question that way. And we'll do that for just another moment or two. And then we've got a few other partners that are going to speak. Anything else I've missed, either Melissa or Valerie?
What is being done to educate the homeless about the situation and to mitigate their spread as vectors?
So that's probably a better question for after our medical professional leave, because that's really done through the county. So perhaps we can narrow questions to the medical professionals so that they can move on to other important activities they have today.
And we can definitely come up with that. We'll come back to that one in just a moment. But good question.
Mayor McGallion?
Yes.
About eating raw fruit and vegetables.
Go ahead. I heard somebody.
Yeah, I saw a question come across the group chat, and I thought I should probably clarify, because I think that my answer around testing may have gotten some of the listeners confused. So I want to just clarify my statements. So if you feel that you have symptoms, whether you're a Kaiser or a John Muir patient, if you feel that you are getting sick and that you have the symptoms of COVID-19, you should, and if you are mildly to moderately ill, you should contact whatever the normal mechanism is, whether it's a advice nurse at Kaiser or whether it's your primary care physician at John Muir Health. If you go to johnmuirhealth.com, we have a whole bunch of information on our website of information to contact. If you are deemed to need to come in, you would be tested through our urgent care centers. When I was talking about emergency rooms, is if you are, you feel that you are getting sicker and that you need emergency care, that's when you should go to the emergency rooms. I just wanted to clarify that.
Okay. Thank you. Okay. And there was just a kind of a quick question in terms of recommended materials to make temporary masks. And I'm just going to kind of throw this out there. In terms of recommended materials, it says different types of cotton, but also in some cases, can a scarf work just as fine? Bandanas, what does that look like? Any major recommendation in that regard? Or is it primarily just having some kind of cover?
I would say that it's primarily just having something to cover your mouth, again, in case of a cough or a sneeze, when you're out and about.
And
Okay.
he has some more specific guidance on their website.
Okay. And you said the CDC does?
I believe so, yes.
Perfect. Thanks so much. Okay.
The reason I brought up homeless people during this session is because the homeless folks are dropping fecal matter all over town because 98.9% of the restrooms are locked in town that were previously accessible.
Mm-hmm. Let's see. I'm sorry. Let's see. Who was Valerie? Did you want to go ahead and talk about that really quickly?
I'm happy to talk about it, but I do think we should respect the time of the doctors first, the doctor and nurse. And so why don't we finish that and then move on to the questions that are to the city of Concord.
Okay.
The doctor mentioned that the virus is spread through fecal matter, and that really hasn't been addressed before.
Actually, let me clarify that. I don't know that there are any documented cases of it being transmitted by fecal matter. It's a theoretical possibility because it has been found in feces.
Okay. Thank you. Okay, so what we're going to do, I don't necessarily see any other questions for the doctors at this point in time. So we'd like to thank
I do have one question about raw vegetables and fruits that we purchase at the grocery store. They may have been handled by multiple hands before we bring them home. Is it safe to continue eating raw fruits and vegetables?
Absolutely. I would just wash them when you get them home.
Cold water is sufficient, or wash them in what?
Cold water should be sufficient.
Okay, thank you.
Okay. All right. Well, thank you, doctors. We appreciate your time, and thank you for joining us this morning.
Thank you so much.
All right. Okay. So we're going to go ahead and just kind of move on really quickly. We did have that one other question that came in. So Valerie, if you want to go ahead and just kind of talk about that really quickly in terms of some of the different things that we're doing and best practices we're taking right now and why.
Yes, I'm happy to. So again, this is Valerie Baroni, City Manager. In terms of supporting and protecting our homeless population and minimizing the impacts they have from a health safety risk on each other and on our general population, we have been working very closely with Contra Costa County Health Services, which I think most people know are the lead agency in providing services to homeless folks, or folks experiencing homelessness. So we have shut most of our public bathrooms because we are operating under 3 goals: public safety, employee safety, and provision of essential services. And we can't keep our bathrooms clean enough that we are confident that they don't become a point where there is exchange of COVID-19 virus behaviors, and we can't make that happen. So what we have done, and we're also trying to discourage congregation and use of the parks in those ways. And most of our public bathrooms obviously are in our parks. So we have taken 4 porta potties with hand washing stations and put them in our parks that have the highest demand from the homeless population. We've also worked with county health, and one of the goals county health has is when there are multiple people together in tents or in encampments, to get them to spread out. And so we provided additional tents that they could use to do that outreach and work with individuals. And then of course we have started a housing program for the homeless that are most vulnerable. We also have our public works department. One of the reasons that comes up a lot is when you see our public works employees out in our parks, are they doing essential work? Well, you've hit the nail on the head. Sometimes there is absolutely undesirable things in our public areas, from needles to human feces. And our employees are out there every day ensuring that we maintain these common areas in as healthy and safe an environment as is feasible.
Okay, thank you very much, Valerie, for kind of updating everybody on that. And again, we'll go ahead. What we'll do is we'll take some other questions on the back end. But thank you so much for that.